Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Rachmaditya Pancarani and my partner Meily Kusuma Putri. We would like to presentation about bipolar disorder, difficulties in managing emotional ups and downs in an entertainer life as a case report, supervised by psychiatrist Dr. Alisa Wulandari. Bipolar disorder is a chronic disease of abnormal mood characterized by episodes of elevated mood or depression, or less frequently, a mixed affective presentation of both. The prevalence was high. There is 1 until 2% and is the fifth cause of disability in the world. According to WHO data, on 2016, there are 60 million people are affected by bipolar, but in 2019, there are 0.51% the population with DD, from 10.68% population with mental health disorder, and in Indonesia, there are 0.34% with 909,393 number of people. The patient is 25 years old married woman who have one child and live in Melong, South Cimahi, and her profession is public figure. The first symptom was in 2012. These symptoms have occurred since she was 6 years old when her father was died. Therefore, she was depressed and has hallucination that she saw her father. She was hospitalized and diagnosed as having major depression, bipolar, and psychosomatic disorder, and treated with risperidone and trihexyphenidyl. In 2013 until 15, she took acceleration school to college and worked in the entertainment industry, and she got married with a 32 years old man and have the problem in the married life. She was hospitalized for the second time with manic symptoms. In 2017, she was hospitalized for third time in Karyadi Hospital and she got ECT and has improvement condition. 2018 until 2020, she married for the second time and got pregnant. Because of that, she stopped her psychiatry treatment and after having birth, she got baby blues because of problem with her husband and hospitalized for fourth time and got treatment with antipsychotic, mood stabilizer, and anti-anxiety. And after hospitalized, she left her doctor with her mother and moved another city to healing because her manic symptoms still improved. In early January until February, she hospitalized and got rehabilitation because of her manic symptoms. She increased a number of hikes in smoking, taking drugs, sexual relation, and having affair with her workmate in television station. And now she got hospitalized in Dustira Hospital because her mother is getting tired of her and to keep her away from her brother who focused on taking exam this month. In physical examination, general and neurological examination was normal. And in psychiatric examination, there is difficulty initiating and maintaining sleep, and she has hyperactivity for behavior and has manic and a history of irritable, inappropriate affect. Access diagnostic for Axis 1, bipolar affective disorder, manic without psychotic symptom, Axis 2, borderline personality disorder, Axis 3, no diagnosis, and Axis 4, problem with the primary support group and workplace, and Axis 5, GAF score is 60 until 51.
Please allow me to continue the presentation. So based on DSM-5, bipolar disorder is divided into two parts. First of all, bipolar 1 disorder is characterized by two different episodes, such as manic and depression episodes, and while bipolar 2 is characterized by a hypomanic and depression. Mania defines as emotional state with grandiosity, irritability, hyperactivity, excessive talking and thoughts, and etc. Mania can occur unexpectedly and lasts between 2 weeks to 4 or 5 months. Depression, defined as an emotional state with 5 or more of the following symptoms, have been present during the same 2 weeks period and represent a change from previous functioning. At least one of the symptoms is either depressed mood or loss of interest. In these patients, there are main symptoms and 4 other symptoms, namely an increased affective state or irritability, increased activity, more talking, jumping ideas, decreased need for sleep. These symptoms have lasted for a month, and there's a healing episode in every episode. Thus, the diagnosis of bipolar manic episodes without psychotic symptoms can be made. These are all the first-line therapies that can be given to the patients with PD. In this patient was given quetiapine and allopurazole, which are included in atypical antipsychotic drugs because it can reduce positive and negative symptoms. These patients also require long-term treatment, and atypical antipsychotic has minimal side effects on extrapyramidal syndrome than typical antipsychotics. She received 2 types of drugs because the aim was to reduce the dose of quetiapine, which had a side effect of increasing weight. Okay, she works in entertainment industry. There are many things that affect a person's mentality, including intense of competition between fellow public figures, level of popularity, judgment from fans, and public figure colleges. There are several factors that become risk factors of PD, consisting of biological, such as biogenic amines and other neurotransmitters disturbance, the genetic, psychosocial, life events and environmental stress, personality, psychodynamic factors in depression, such as a long-standing depression, psychodynamic factors in mania, such as impulsive behavior. Many factors that could be further worsen the prognosis. There are some listed in this table. Also include abuse of alcohol and alcohol consumption. In this patient, the symptoms appear from a young age, and she has a habit of smoking, consuming alcohol, and taking drugs. Thus, the prognosis in this patient will be worse. In people with PD, the mood is unstable, hyperactive, sometimes excessively sad, and at other times extremely happy. The types of treatment given depend on the symptoms experienced, such as the suppression of psychotic symptoms, aggression, agitation, and sleep disturbance. In some other cases, in order to provide realistic treatment, it is necessary to consider the background, family conditions, work and social environment, and etc. The prognosis for patients with bipolar disorder with manic and depressive episodes is worse than for patients with major depressions. That's all from us. May all those we have shared be beneficial for all of us. I would like to apologize if there's a mistake. Thank you so much for your attention.